Skin cancer is the most common cancer diagnosed in the U.S., but Utah is actually one of the highest related to death of melanoma.
Well, and we're just talking to Reagan, yes. And in Summit County, her neighborhood there, the highest rate of melanoma diagnosis in the entire state. It's that elevation there. Troy takes a closer look at this very serious health issue in tonight's brand new episode of Younger You. Here's a sneak peek.
Thanks, team. Well, tonight is all about cancer and some great conversations that I'm about to have with Dr. Thompson. But first of all, let's look at this short clip about tonight's episode.
I'm Renee, and I'm 65 years old. I had some skin cancer on my nose and some on the top of my head.
So Renee has 2 skin cancer defects that we're going to be fixing today. And one is up here on her scalp. This is called a pedicle flap. And this tissue right here is connected to her nose from her cheek. And that's what this scar is right here.
Dr. Thompson, thanks for joining us again.
I'm happy to be here.
Okay, this is a topic that not everyone likes to talk about. Cancer, skin cancer. These are some viewers' questions that were sent in. What happens when someone lets their skin cancer go too long?
It depends on which type of skin cancer it is. It can be a life-threatening problem for waiting too long, or it can just be a local problem where it slowly grows and invades structures around. But either way, it should be dealt with soon. Okay,
so by you just telling me that, there are obviously different types of skin cancer.
Yes, very dramatically different types. Basal cell carcinoma is the most common, but it's a very slow-growing cancer. It tends to stay in the area where it is. Melanoma is the killer. Most of us have heard of it. That one spreads to different parts of the body.
Okay, these are all questions from our viewers. Okay, why is it so bad to get sunburn?
Sunburn just damages the skin in a way that opens it up to free radicals, which are chemicals that damage the skin and increase the chance of getting skin cancer. It also makes the skin age more quickly. So there are lots of reasons not to get sunburn.
Dr. Thompson, another viewer writes in about tanning oils. Do they help protect the skin or do they make it worse? Now, we're not talking about sunscreen. We're talking about the tanning oil.
They probably make it worse because they just allow the rays to come in even more to the skin, and they're definitely a bad idea. And I think most people know these days to stay away from tanning oils.
Okay. If someone has a mole, let's just say I have a mole and I go, oh, that's turning into a funny colour. Do I come and have it checked with someone like you, or do I go to my GP first?
Most people have a dermatologist, so that's usually the place to go if you have a suspicious mole or any kind of suspicious area on your skin. You can start with your general doctor, but usually dermatologists are really specialized in looking at moles.
Dr. Thompson, as the public are listening to you, how do they know they're going to the right dermatologist? Does that make sense? Because
yes, there are some dermatologists that specialize in skin cancer, and there are different types of dermatologists. And we have a list of dermatologists that we work with that we recommend to have these things checked.
So we're telling people to give you a buzz, you recommend them, the dermatologist to the patients, and then you all work together.
Absolutely.
I love that. I love that you've been able to answer the viewers' questions. We really appreciate it, Dr. Thompson. If you want to find out more information about Dr. Thompson and Utah Facial Plastics, head over to theyounger.you.tv, and I know you're going to find tonight's episode fascinating. Back to you in the studio.
All right, thank you, Troy. Coming up, we're talking about this. Is it safety or snooping? Schools are starting to monitor social media accounts. We want to know what you think. We'll be discussing it